Dr. Frieden, more than 300 pregnant women in the US and its territories have now been infected with the Zika virus. Just how short a time does the US have to respond before we see even more cases?
The window of opportunity is closing. Mosquito season in the US is upon us. The risk is different in different parts of the US. Puerto Rico has been dealt a bad hand by nature, and they're likely to have many, many infections. For the rest of the US, we've advised pregnant women not to travel to Zika-affected areas, and if women follow that advice, we should see a decreasing number of infections. There is the possibility of some local spread in some parts of the US. We think that will be relatively focal and limited, but we need to take every action to minimize the risk.
But potentially, how many cases could we see in, say, the southern United States, the Gulf Coast states, where it's going to be extremely warm this summer?
We don't expect to see widespread transmission in the southern continental US. This is a mosquito that only travels 150 yards. So it's not common for it to cause a widespread outbreak, except in an environment as there is in urban areas of Brazil and Colombia and elsewhere, where it can bite many people in a small space.
Would you advise women in the United States who are thinking about getting pregnant not to do so because of the threat from Zika?
Absolutely not. For women in the continental US, the risk is extraordinarily low. The key is, if you're pregnant, don't go somewhere where there's Zika spreading. And if you're a male and you've been somewhere where Zika is spreading and your partner is pregnant, use a condom. Now, the situation in Puerto Rico is different. Puerto Rico has a much, much higher level of risk than elsewhere in the United States. And in Puerto Rico, our focus is to provide the information for women. I don't think the role of government is to tell women whether or not to get pregnant. But if a woman decides that she wants not to become pregnant, it's quite important that she have access to voluntary, effective contraception. And unfortunately, right now in Puerto Rico, there are some gaps with that availability, as there are in many parts of the world.
President Obama has asked Congress for nearly $1.9 billion to fight the spread of Zika. Congress hasn't come up with that much money. What are the risks if you don't get that cash?
At the end of the day, Congress did the right thing with Ebola. They gave us the money that allowed us to stop the epidemic. And I'm hopeful that at the end of the day, Congress will do the right thing on Zika. Failing to provide supplemental emergency funding would have real consequences. We wouldn't be able to pay back the money we've borrowed that's keeping people safe today, and we wouldn't be able to begin many of the crucially needed projects to understand Zika better, to develop better ways of diagnosing the infection, and better ways to kill the mosquitoes so that we can protect women more effectively.
One public health expert has called for the Olympic Games in Rio this summer to be moved or cancelled because of the public health risk from Zika. Do you agree?
No. I don't think there's any reason from a public health standpoint to cancel or postpone or move the Olympics. The risk is to pregnant women, and that's what our advice is about. If you're pregnant, you shouldn't travel. If you're pregnant and you need to travel, you need to be really careful about mosquitoes. And for men who travel, whose partners are pregnant, you need to use a condom. One claim is it may spread Zika through travel, but the Olympics are a tiny fraction of all travel. There is global travel. We're not going to change that. We need to make the world a safer place by improving systems to find threats when they emerge and stop them wherever possible.